Hello, everyone. This is Dr. Mike, your physical therapist. Hey, today we got a special guest, Miss Daphne Foust of Foust Medical Clinic. We'll be back in a few seconds, okay? All right, we are back here. We are here in Paris, Tennessee. I'm here with the good friend of mine, Miss Daphne Foust. She's actually a physician assistant. She owns and operates Faust Medical Clinic. And I asked her, hey, Miss Daphne, could you please teach us, about different common medical issues that we encounter with the seniors? But without keeping going, let me ask who she is. Let's ask who she is. What does she do really, and where's she at? So, Miss Daphne, who are you and what are you doing here in Paris, Tennessee?
Well, we came here to Paris, Tennessee in 2012. I
Mhm.
came here to work in the emergency room. And after working there for a while, I had the opportunity to have my own clinic.
Mhm.
So I picked up and took off with my own clinic. And it's been quite a journey, quite an
Wow.
adventure.
Hmm.
And so we're just here taking care of lots of folks.
Hmm.
We're an actual rural health clinic. So we
Hmm.
take care of people in the community that often don't have anywhere to go, sometimes
Hmm.
have no insurance, no financial means to get health care, and we try our best to make healthcare accessible to
Accessible.
them.
Yeah.
And we see people, that don't have insurance and can self-pay, and we work with people as best we can to make sure that they get some exposure to healthcare
Mm.
because we feel like where people have some hope, there's definitely the ability to heal if you
Mm.
have some hope.
Mm.
So
I love what you said. Hope. We're actually really technically hope dealers. We're giving out hope to
yes,
even the physical therapy. It's like they always ask me, "Hey, am I really going to get better?" Yesterday, I had a Parkinson's patient, and he was like shaking and everything. And then, you asked me to come in here for two times a week. Am I going to get better? I said, well, you're going to only get better if you do it and come here regularly. So, but you mentioned about coming here 2012, Miss Daphne. So, where are you originally from?
I grew up in a little town called Alamo, Tennessee.
Okay.
So I was raised here in West Tennessee, and Paris was part of places that we went growing up. But it
Hmm.
was kind of a special trip because it's almost 80 miles to
Yeah.
Alamo from
Yeah.
here.
Hmm.
And so I went to Alamo High School before it became Crockett County High. Went to Mammoth
Oh.
College, did my 4 years there. Went to pharmacy school for a couple of years, just was not for me. And in the
Hmm.
meantime, applied to PA school, got accepted, and I've been doing that now. This is my 36th year in
Wow.
August. So,
Wow.
yeah,
36 years.
yeah,
I
for a
wasn't
good
even
while.
born. I'm
Just
just
a little
kidding.
while. Yeah.
Wow, 36 years. Imagine doing that and serving the community here. So you mentioned you moved here in Paris and then you started your own rural health clinic. What are the most common cases that you see here?
Well, we
Mhm.
have a lot of diabetes,
Oh,
hypertension,
wow.
COPD. I see a fairly significant percentage of psychiatric problems with
Hmm.
depression, PTSD, bipolar, and we have a counselor that rents space here, so we
Hmm.
can refer people for counseling
Hmm.
if they need it. I do a lot of chronic disease
Yeah,
management,
yeah.
a lot of chronic disease management.
That is actually what is happening now. We're treating clients, with chronic condition, hypertension. Obviously, it's number one.
Yes,
COPD. We got a lot of plenty of clients who
tons
have
of that.
people
Yes.
smoke, chew tobacco and everything like that. And of course, you mentioned about mental health, and that is just growing and growing now, Miss
Well,
Daphne, right?
the mental health field is just so limited in our
Mm-hmm.
resources, and finding places for people where they can actually get help or they can
Mm-hmm.
afford help. I mean, there's so many people that can't pay the prices that mental health quite often requires,
Mm-hmm.
and the facilities for people to go to improve are very, very expensive
Mm-hmm.
and difficult to find, and sometimes difficult to get placed. So
Mm-hmm.
it can be very challenging when you do mental health.
Well, on that note, or we're already talking about it. So, what are the different interventions that you know that a person that has anxiety, depression, can they just go directly to you, walk in here, and everything like that?
If they need a family
Hmm.
practice
Hmm.
provider, they can come here. If they already have a family practice provider, I would suggest that they speak to them about what their problems are and what resources they would have to try and help them. But if they need a primary care provider, they can, of course, come here and we can talk about what we can figure out to do for each individual patient and see what resources we can scratch up for them to get some help. And of course, there's always medications, but my biggest foundation is people have problems. They have medical problems, they have mental health problems. But if you don't find the source of that problem, i.e., in psychiatry, quite often there's trauma. There's been some kind of event or something that's happened to them in their life that has just kind of spun out of control throughout their life until they're so anxious or so depressed that they're just dysfunctional. But sometimes the foundational issues are never identified or treated, so these people don't have a chance of improving very much until you know what you're treating and how to get them better. Because medications are great, but do you really want to take medications your entire life if you don't have to? If you can find the cause of your illness, make your lifestyle changes, your adjustments, whatever it is you need, whatever treatments you need to get back to a normal baseline, and hopefully not have to take, a handful of medications every day. Because I do believe in the long run, a lot of the medications that we prescribe do people harm over the long haul, and that's not what we're supposed to be doing for people.
That's true. We're not even finding, like what you mentioned, the root cause of it. That it could be the past trauma that you had, family, relationship trauma, physical trauma, emotional, financial trauma too.
Definitely.
Financial struggles. So before I came in here, I dropped off. I'm mainly active in Facebook. There's this guy online asking for a luggage because he's just gonna get out of the hotel or the motel he's living in. He's just carrying a plastic bag. And I said, hey, I got this extra luggage at home. You want it? And he said, yeah. So I drop off there, and when you look at him, in his Facebook thing, and he looks like he does have trauma. And looking at it, oh gosh, this guy.
The pain that people carry around with them for years and years and feel like they have nowhere to turn. And sometimes the types of trauma are things you can't talk to family or specific people about. And so people feel like they have nowhere to turn, nowhere to go. And so a lot of people live with it for many, many, many years, not realizing that there are people in the world that can help them and keep their issues confidential.
Especially, the older generation, the younger generations, but they're more accepting now. They're more aware that they can call and grab a telehealth call or something. They're more aware of it now. The older generations, the people that we serve, the seniors, especially the nursing home. I mean, some of the behaviors that comes out, it's not really. It could be dementia and Alzheimer's, but probably some of the mental illness and the psych issues are from the previous past trauma they've had.
It can be.
And they haven't been able to express it out. So, with that being said, Ms. Staff, uh, so you mentioned about you got a mental health counselor here. So, what do they know? Do they talk to the
There's
client?
cognitive therapy. There's several types of therapy. Not all of it is done here. But one of the biggest, or I wouldn't say it's new, but there's a treatment out there called EMDR for people with trauma and all kinds of things that has quite a bit of literature supporting its effectiveness.
What does EMDR mean?
Movement desensitization.
Do they put like
It's
VR?
a movement and tapping. It's a wide variety of different exercises. I'm not an expert in informing you in exactly how it's done because I've never been through it and I don't have any patients that I know of that have completed EMDR. So there are lots of things out there to help people, and there's more and more things coming about to help people that are more natural, not as invasive as procedures and medications and things like that. Because I think the medications sometimes alter based on personalities.
That's true. Yeah. So, that's true. It's chemical. It's actually a medicine that you take. It changes your chemical, your hormonal.
And then you have people with all these chronic diseases, and they have this too. So you've got a list of medications like this, and my goal is to get medication list as small as we can and as healthy as you can and feeling better without feeling like you have to take a pill to be a human every day. You
Mm,
should be able
mm.
to make changes, but the patient has to participate. They have to take the responsibility of changing their lifestyle for simple things like blood pressure, cholesterol. You have to make the lifestyle changes
Mm.
to improve that. Sometimes that involves weight loss. Sometimes that involves changing your dietary intake of salt, of sugar, or, what if processed foods, fast foods, everybody lives a convenient lifestyle. They
Mm.
don't cook at home. They don't eat at home. They're hardly ever at home because they've got children and then they're in every known sport, that you can think of.
That's true.
So every night they're here, every night they're there. There's not a lot of family dinner time anymore. And so people live a very convenient life. And in the long haul, we all pay a pretty nice price for that too,
Yeah,
because we
yeah.
don't take care of ourselves,
Well, like what you said, it comes down to our lifestyle, our choices.
our choices
Yeah,
every day.
and it's also important. You got to be intentional with that choice.
Mhm.
It just can't be a wandering generality. And you got to be meaningful, specific. Hey, I'm not going to eat this,
Right.
salt to increase your blood pressure, your sodium, and your potassium, and everything like that. And then now you got chronic hypertension problems. So, Ms. Daphne, so you mentioned about lifestyle and activities in the community. Do you have like a recommendation that that they do here, or
I think recommendations for activity are specific to each individual. I don't, diet and exercise are not the answer to losing weight and being
yeah, yeah,
healthy.
yeah, yeah.
They're only a fraction
Mm-hmm.
of it. People have to change their lives. We have to get rid of stress. We have to
Mm.
sleep. We have to nurture our bodies. We have to move and exercise, but we just can't. Some people just can't do all of that stuff, and because of physical limitations. And when
It's
you have
true.
physical
It's
limitations,
true.
you have to. So I tell a lot of people to swim. If you can just walk 20 minutes a day, it's very, very helpful and
Walking
beneficial to you.
is very
So,
very good. So uh, when you're walking, when you're exercising, you release certain hormones, your dopamine, your oxytocin,
endorphins,
and
all
your
your
endorphins,
endorphins.
all those
Mhm.
stuff. It actually a natural painkiller. So
And you'd
uh,
be surprised how many people in this community don't realize we have such a wonderful swimming here at the Civic Center. I
mm,
went for almost 2 years swimming every day, and it was just amazing. I got out of the habit, which is bad, and this business kind of takes you away from your own
hmm
personal
hmm
time. But it, it's a wonderful pool and a wonderful facility for a lot of different people to go and have a place to walk. They have a
hmm
walking track that's indoors. They have basketball courts for younger
hmm
kids. They have the
hmm
swimming pool, and um, I don't know. It's just a really, really nice, affordable option for
actually,
people
yeah,
to go there and be able to take the family there. If you want to go work out, your kids can go swim, or you want to go walk, or whatever you want to do. And then we have this beautiful park down the road here
hmm
that there are all kinds of walking trails that are outside. You can get your kids outside, get some sunshine, breathe some fresh air, get the electronics out of their hands, get away from the
mm.
TV, all of the things that are good for us that we tend not to do so much anymore. Most people don't garden anymore, so we don't eat a lot of fresh fruits and
Yeah,
vegetables unless
yeah,
we buy them in the store.
yeah, yeah.
And we just don't do a lot of traditional lifestyle kind of things
hmm
anymore. Everybody's living a really fast paced life, even
Yeah,
in the
yeah.
rural areas.
I know you would think here in the rural area here in Paris that you'll have like people who would, you mentioned gardening. Gardening is very important. It's
Yes,
really a good therapy.
it is an excellent therapy for
It's
many people.
amazing. First, you're grounding yourself.
Yes,
You're touching the soil and you're having that electrical impulse, that grounding.
that's correct.
It's good for your mental health because you're developing patience when you're seeing your plant grow or that fruit grow or whatever that vegetable grow. And then part of it too, you're going out, you get the sunshine, you get all this nice, good, energy, and then you're not really using your phone.
Right.
You're you're just focused on one task at a time. So thank you for pointing it out too. I also love that you pointed out that our civic center here. It's very nice. I've been there.
It's amazing.
It's amazing.
Really sweet people. The
hmm
last time I was there, I haven't been there in a while, but
hmm
really sweet people running it, and they're just very kind and they work with everybody.
That's
And
good. That's good.
I had a really, really good experience with the
hmm
Civic Center. So
There you go. So, Ms. Daphne, on top of that, you mentioned, I know we don't advocate for a lot of medication. Yes, she is a medical clinic, but the reason why I like really Miss Daphne is because she's an advocate of decreasing those medication because not 100% of the time, but most of the time, those medications, they have side effect. And some physicians or practitioners, they just give another medication to counteract that side effect of that medication. So, which is not really good. So you just,
Sometimes you have
mhm,
to, but
mhm.
if you can get away from it, you like to explore that option as well and
Yep,
see
yep.
if it works for that
And
patient.
balancing out, it's all about the balancing act. So, you mentioned about medication management,
Mhm.
right? You mentioned about lifestyle changes,
Mhm.
going to a mental health counselor. What else can you tell them? Uh,
Be true to yourself.
True to
Be
yourself.
true to
There you
yourself.
go.
Know who you are. Know what you
Hmm.
want, and you know, self care is something a lot of us just don't do anymore.
Mm,
We just
mm,
don't take care of ourselves. We're busy taking care of kids, and some people take care of their elderly. I have a mother with dementia who is about to move in our home, and
mm.
we're going to take on some pretty interesting challenges
Another
there,
test
and
there. Yeah, yeah.
changes life dramatically, especially for the person that's older. It's very, very, very difficult, very emotionally traumatic for them to come out of a home. I mean, my mom's lived in her home
Yeah.
at least 62 years. And
And then you're
so,
changing the
mhm,
environment, right?
changing everything about their life. But if
Uh,
she's here in Paris, she can go to Jerry
there you go. And work out there, right?
get her out
Hmm.
of the house. She's
Hmm.
not getting out of the house and doing enough. And sitters, sitters can stay with people, but these sitters, one of them's been with my mom for 5 years, and
Hmm.
the other one has been with her 24/7 for the last 3 years. And they have lives and family, and
Hmm.
things change in people's lives, and so things are changing, and we just have to go with the changes.
That's true. That's true. I love what you said about self-care. And always
Mhm.
remember this, ladies and gentlemen. Self-care is not selfish. It's
Mhm.
very important that you take care of yourself because you cannot give what you do not have. That's why it's called caregiving.
Mhm.
You're giving care. Actually, they even changed that term, caregiving, to they changed the term. Uh,
Um, oh, you would ask me, and I wouldn't be able to remember
I know,
in front of
right? I mean, it's just
everybody.
the tip of my tongue, but
Yeah.
they changed that term because they're giving too much care, and then they kind of changed that term to I forgot. I'll probably remember it now
Well, you
when.
have different levels of caregiving too.
Hmm.
You have people who are sitters who
Hmm.
basically sit. I mean, they
Hmm.
sit with patients to make
Hmm.
sure they're safe. And some sitters do other activities, a lot of them do not. And
Hmm.
then you have a caregiver who does A to Z with a
Hmm.
patient that
Hmm.
needs care for whatever time of day
It's
or
true.
length of
Hmm.
time that they do. And then sometimes you have live-in people like I've had for my mom the last 3 years. She's had somebody that lives in her house 24/7
Mm.
to help her out,
That's good.
So,
That's good. Well, let me go back to that caregiving spiel that I have. It's called
okay.
caregiving. You cannot give care because if you're not taking care of yourself. So if you are a caregiver right now, that's like Miss Daphne, she's going to take care of her mom. It's very important that she takes care of herself too. So if you are a person taking care of your loved ones, like a spouse who has dementia or Alzheimer's, you got to take care of yourself too because evidence-based shows that people who take care of their loved ones actually get sick and die early before their level because they forget to take care of themselves.
That is true.
They get hypertension, they get diabetes, and now they're taking care of that person, and they forgot to take care of themselves. So, Miss Daphne, thank you very much for your time. I know you're very busy. Where can they find you? Where can they find you? Telephone number and everything like that.
We're at 849 Volunteer Drive. We're in Suite 2, and just because everybody knows where Sweet Jordan's is, we're
Mm-hmm.
right beside Sweet Jordan's. And our phone number is 731-540-7075. And I hope that we'll see you soon and be able to help you in any way that we can.
All right, perfect. Again,
Thank
thank
you
you
for your
very
time.
thank you, Miss Daphne. Again, thank you very much, ladies and gentlemen. But before we let you go, always remember the word fast. FAST, letter F. Find people that will bring out the best in you because you are the average of the five people you hang out with. Today, I hang out with Miss Daphne. I've been hanging out with her for like years now. And every time I talk to her, I get all this wisdom from her. So make sure you be intentional about finding people. Find a practitioner that's your best interest. Find the therapist that will take care of you. Find a community that will actually support you. So that's very important. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Miss Daphne good if you don't take action. Take action. Go to their website. No, their Facebook page. call them, ask, hey, how can you help me? Sometimes you just have to ask people, hey, I need help, stuff like that. All right. Next letter is share and subscribe. The more shares, the better. Share their Facebook page. What's the name of your Facebook
It's
page?
Faust Medical Clinic.
Faust Medical Clinic, and her website will be up soon too. We'll help her out with that too. And then, of course, last but not least, is letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. Again, thank you very much. We appreciate you. Thank you, Miss
Thank you for
Daphne.
your time.
We'll see you again on our
Thanks.
next episode of our Jerry Hab Show. Bye bye.